It's one thing just trying to learn how to get your ostomy bag to stick to you. It's a completely different thing trying to get that bag to stick to you on top of severely broken down skin. Hey guys, it's Maggie and I am back today, and I thought in today's video we could talk about common skin breakdown issues around your stoma. And I'm going to be sharing the ones that I have experienced myself. They are a bit more common, they're seen more often. There are so many different things that can happen to your peristomal skin, many different conditions that kind of vary on how serious they are and what it takes to treat them. I really want to focus on the ones that I've experienced because I can show you what they look like. You know, I have images or videos of them, but I can also share my personal experience in what they felt like and how I got them resolved. It is so important if you are experiencing any kind of skin breakdown that you are not familiar with, go to your healthcare provider, your stoma nurse, your WOCN, whoever you see for care for your ostomy, because like I said, they are on a range of seriousness, and some take, you know, some hardcore treatment, and there are other things that are fairly simple, you know, easy skin breakdown that you can manage at home. And going to a stoma nurse or a healthcare provider that is familiar with ostomies, they can help you identify what's going on, so that way you know what it looks like on your skin, and they can help you identify the things that'll help them. You know, just like we all use different skincare products for our face, you know, if you've got acne or dry skin or whatever, your stoma skin is kind of the same. We all are gonna do better with different things. But I thought this video might be helpful just for the very, you know, basic common issues that you can see. You can see them on my skin and you can become aware of them, ask your healthcare provider about them, and just, you know, learn more information. Some of these I didn't experience until well into life with an ostomy, and I was like, what the heck is going on here? So, you know, I thought this just might be helpful. I know that can be a large expense for some, but when you're in these situations kind of running through your ostomy products because nothing's sticking to you, I think it might be worth it for some. So I just wanted to make you aware. I'm going to put that information below, as well as some different guides that can help you look at all the different types of peristomal skin issues, just so you're aware of them. But let's jump into the ones that I've experienced. All right, so your most common one, the one that you're probably gonna become most familiar with, I think a majority of ostomy patients deal with it. We're talking about the regular old skin breakdown from leaks. You know, our output has a lot of enzymes, and even it just containing moisture and sitting on the skin can lead to the skin breaking down. You know, you'll really see it where you experience a leak, usually close to the stoma, right around the stoma. And I've certainly dealt with that, especially early on. One of my first experiences in the hospital, I had such terrible skin breakdown, and a nurse that really didn't know ostomy care all that well. And I had experienced a leak all the way out to the edge of the flange, and they took tube paste and they squirted the tube paste into the leak and just left it that way. So of course my skin broke down. Don't do that. You obviously want to change your ostomy bag as soon as you feel a leak, as soon as you feel any itchiness or burning or lifting. You'll want to get it changed out. And the thing that really has helped with this is stoma powder. You're going to hear that from your nurse. That's probably one of the things that they taught you in the hospital when you got your stoma. Stoma powder is a great way to help dry the skin. You know, it kind of pulls some of that moisture off of it, but also makes this layer. And it's called the crusting technique. It's actually something I learned when I was a nurse on a GI unit for children. I was a pediatric GI nurse, and you know, a lot of the babies that we had terrible diaper rash, like just the worst, because they're dealing with different GI things. And so we used the crusting technique. It was kind of a mixture of stoma powder, Desitin, or something, you know, some kind of zinc oxide-y white diaper cream, and a little bit of skin barrier, and we would layer it up, make it really thick to help protect the skin. Well, there's sort of a version of that for people that live with stomas, and it's pretty straightforward. you use a bit of stoma powder directly onto the affected skin after you've cleaned it, after you've removed everything. You put it onto the skin where it's open, and then you put on a little bit of skin barrier. The trick with ostomies that, kiddos with diapers don't have to deal with, they're not trying to stick any adhesive to it. When we're wearing an ostomy bag and, rely on adhesive, powder on adhesive doesn't work so well, so you really have to seal it in with some good skin barrier, and you want to do as light a layer of that stoma powder as possible. Honestly, if I see any white after I spritz the skin barrier on, then I know I'm gonna have issues with my bag sticking. Even though I've had my ostomy for years, I still have this every now and then. I still keep a bottle of stoma powder on hand. Thankfully, those bottles last you forever as long as you're not having skin breakdown all the time. And I don't use stoma powder with every change. I started off that way, but quickly learned that it really can inhibit the ability of the ostomy bag to stick. So I only use it when I see active open skin. The next one, I actually just experienced, was it last week? Maybe the week before? A fungal skin infection. Now, these are, I think, the most irritating, really more painful. So what happens, especially in the summer when it's really hot out, I get in the shower and my ostomy bag gets wet, and I'll put on high-waisted jeans or shorts or whatever. I put something on that really doesn't give my ostomy bag a lot of airflow. And so that moisture on the fabric of my ostomy is sitting against my skin, it's warm out, I get a little fungal infection. I think I have experienced it under my flange, like right around my stoma, maybe once, but I actually experience it more around the edges of my flange and like a little bit beyond that, because that's where the moisture's sitting. An ostomy flange really is a wound care product. It helps pull moisture off of the skin. So it sort of in a way works to prevent that from happening. But of course, outside of that perimeter of the flange, there might be moisture and there's nothing to absorb it. So I've been really trying to be good about wearing my ostomy cover that helps pull moisture off, the stoma cloak, but when I forget, I get some of this fungal infection, and it looks like little dots. It's like little red dots. For me, those little dots, when I start to notice like pain on the skin, that's really when I know a fungal infection is involved. The way I noticed it this last time, I think I sat down in a chair, and when my leg bent up against my ostomy, it moved the skin under my flange, and I was like, oh, why is it sore there? And I looked and I saw all these little like pinpoint dots. And so I knew, shoot, we got a fungal infection going on. So this is something that you might want to go to your WOCN or your doctor about, because there are ways to handle this medically with a prescription. And I have done that before. I've gotten nystatin powder. Nystatin powder is an antifungal powder that you can use around your ostomy. It's a little bit easier than using a cream, because if you use a cream, then your bag's not going to stick. So it's very similar to using stoma powder, but it can help get rid of that fungal infection. Now, I actually don't have any nystatin powder on hand. I used to, but I used it all up. But when I start to experience something like this, I try to take any factors away that would help contribute to the fungal infection. So I will use stoma powder sometimes, but I really try to just give my skin airflow, dry it out as best as possible, and keep my ostomy bag as dry as possible as well. Swimming, jumping in the ocean, jumping in the shower. The fabric on your ostomy bag might become wet, and the ones that I'm currently using, the fabric really does retain a bit of water, a bit of moisture, so I really have to be good about drying it. Some bags aren't like that. They don't retain as much moisture. It is what it is. I'm just dealing with what I have, my current products. But yeah, I just have to be really good about drying my ostomy bag, and usually I can get it to resolve just by keeping the skin dry. And I did this last time. It went away within, I think, like 24 hours. It was gone. All right, the next one we're gonna talk about is the one that has impacted me the most. It was traumatic dealing with it when I had it going on. Whew. It's also, at least when I was actively working with WOCNs a few years ago, it was the one that they always said, like, that's pretty rare. Like allergies to ostomy products are pretty rare and unlikely. I don't think that's the case. I really don't. And I'm just gonna share my situation. Again, go to your WOCN to learn more about your skin and what you might have going on. I'm just sharing from my personal experience. So I had my ostomy at this point for at least 10 years, and at the time I was using Coloplast. And what would happen with Coloplast, I started to notice this. They don't have any like paper tape around the edge. At least the one that I was using Sensura Mio, which is a really nice bag. I really like the design of it, but my skin did not. I noticed that if I got into water, so if I showered, if I bathed at all, if I went on a water park ride and just got slightly damp, if my ostomy got anything on it, the flange would swell up, it would stop sticking to me, and then I would start to get this really horrible skin breakdown. And I was thinking, is this a fungal infection, like a really bad one? Is this, I didn't even know. I couldn't understand what was happening. But it really seemed to be associated with moisture and the Coloplast flange. And I'm going to share it on screen here. This is what my skin looked like. It was really around the outer edges of the flange and would worsen when it got wet. And I think there was an element of fungal infection in there just because the skin was weeping. The skin was so moist, and it got to a point where I would get maybe a few hours out of an ostomy flange, but because the skin was weeping, it would pretty much just fall off of me. And I consulted with WOCN friends, WOCN people that I worked with, my nurse practitioner friend who works in colorectal. I was at my wit's end because it was so painful. And I eventually got in with a WOCN at my hospital, and when I saw them, I went through the list of everything I tried. I said I've tried switching products, I've tried all the different powders, I've tried treating it like a fungal infection, I tried different barriers to, you know, put between me and my ostomy flange. I've tried putting Ziploc bags over my bag when I showered, like taping it to my belly, which helped a little bit. As long as I prevented moisture, you know, it wouldn't worsen, but I couldn't get it to heal. And they looked at it and they said, gosh, that looks like a chemical burn or some sort of severe allergy. And so I was going through so many different ostomy bags and flanges, and my insurance was not covering my ostomy supplies at the time. So I was spending over $400 a month on ostomy supplies, which was miserable. On top of, I was paying for my insurance, which was over $500 a month. So I was spending like $900 to $1,000 every month just on those two health things. That's not including other doctor's appointments if I had to do a copay or whatever. It was an expensive year. So the first thing they did was they got me a prescription for ostomy supplies, got me, you know, my insurance coverage that I needed for ostomy supplies. They also started me on Marathon, which was a really thick skin barrier. This is like super glue. I think it's made out of the same thing that super glue is made out of. And it really provided a thick layer of protection that, like super glue, sticks to you real well, like doesn't come off in water, none of that. So they had me seal my skin in completely, which I think helped, especially when my ostomy was exposed to moisture. I also switched brands. So I switched to Hollister at the time, and the thing about it was because my skin was so severely broken down that just switching products was not enough. My skin was just, it wasn't gonna get better as it was continually exposed to moisture, which, like, I'm gonna freaking shower every day, you know? So just changing to Hollister was not enough. It was really sealing and protecting the skin from all moisture with that Marathon. Changing my product so as the skin healed and I was able to move away from Marathon, you know, that mixture of moisture and the flange was not causing this burning. I don't know really if it was an allergy or if it was a chemical burn, but I see other people with Coloplast products getting into water and being totally fine. I wasn't, so I just have to assume it was some allergy to whatever that mixture was. And then I implemented some Flonase, which is just a nasal steroid just the tiniest amount on my skin, and since that, my skin is completely healed, looks beautiful. I thought the rest of my life with my ostomy was going to be that. I started to think, like, is this something worse? It wasn't like pyoderma, you know, the WOCN saw my skin. It wasn't that. It was just chemical burns. I think they were just as lost as me with it, but that marathon really made the difference, really protected my skin. The last thing that I've dealt with, and I recently mentioned this in a video, and somebody asked, oh, what is that? Because I don't really know what that means in the context of ostomies. So I have dealt with granulomas. I've dealt with them for maybe 5 or 6 years. I didn't have any issues early on, which is kind of weird. Sometimes they happen due to like the sutures that they use to, you know, get your stoma to stay in place. Sometimes it can be because of that, but I don't really know why they popped up other than friction. So granulomas are hypergranulation tissue that can happen because of sutures, because of you know, friction or damage to the area right around the stoma. They appear kind of like little bumps at the junction of your stoma and your skin, and they're quite painful. If you touch them, they are, whoo, it's like a shooting pain. And not pleasant at all to deal with, especially as they get larger. You know, you're more likely to hit them, or you're more likely to have your ostomy flange, the edge of it, rub up against it. Sometimes they need to use something called silver nitrate to help burn them off, which thankfully I've never had to do. I've had silver nitrate when I had my bottom incision and it kind of stalled in its healing. Silver nitrate can be used to kind of reactivate healing. Instead, I treated it by doing a couple of different things. The first thing is I used stoma powder, which helped to kind of dry it out a bit, kind of like shrink it down a little bit. But the other thing that I think helped more was changing the products I was using. This is my belief. So at the time, I was using a Hollister Cera Plus flange. I don't know if you've ever used that, if you've ever cut one of those flanges, but if you felt the edge of where you cut, it's pretty sturdy, it's pretty rough, okay? And at the time I was also using tube paste. So I was putting a very light layer of the tube paste around the opening on the flange, and that was my system. And what I believe was happening was the edge was rubbing up against the junction of my skin and my stoma and causing a bit of friction, and that's why I started to get granulomas. So the first thing I did was, instead of using tube paste, I switched over to a barrier ring, and I think that helped a lot. You know, they still appear every now and then. I was using Hollister for a few years, and then I'd say in like the last year, maybe 2 years, I don't know, I started using Convatec, and they've got a moldable flange, and this flange is really nice because you don't have to cut it, and the flange itself is really soft. And as you are wearing it longer, it really softens up, it kind of swells a bit and turtlenecks around your stoma. So rather than having this hard edge that's cut rubbing against my stoma, it kind of is like a jelly turtleneck, I don't know. And so that created a really nice soft area around my ostomy. And also I switched to their barrier ring, the Eken Seal, which is definitely a lot more jelly-like. It definitely swells a bit more, which can be a bit more difficult because it can break apart when you're removing it. I just posted a video of my uncut ostomy change, and you can see a bit of the seal stuck to my skin. I had to like peel it off with toilet paper. I would say that the Hollister Adapt ring doesn't do that quite as much. It really keeps its shape, but it's harder. But I will say I haven't dealt with any major issues with the granulomas. They have not grown in size. All I see now is just these tiny little red areas. That's not regular skin breakdown. It's not from my output. It's like a tiny baby granuloma to remind me that they're there, and if I don't treat my stoma right, that they'll come back with a vengeance. So those are my ostomy skin irritation issues. Like I said, there are many other things that can happen. There are things that can happen with the hair follicle. Thankfully, I don't have a lot of hair on my belly, so I don't have to deal with that too much. Plus, I think 14 years of pulling a flange off of my skin, it might have acted like a wax. I don't know. There's other things like tearing. If you tear your ostomy flange off from your skin too quickly, which is why I always say use this, an adhesive remover wipe or a spray, because that'll help kind of just gently melt the flange off of you rather than you having to, you know, tear it off of your skin. That skin can be fragile, especially early on. You know, you've just had incisions done in it, so you want to treat it well. I think over time my skin has toughened up quite a bit though. You can also get fistulas. You know, if you've got something like IBD like I do, I've dealt with fistulas in the past from my bottom, and you can get them around your stoma. You can get pyoderma gangrenosum, which, you know, a lot of people find that kind of flares with their Crohn's. So a lot of things can happen. I'm knocking on wood quietly because I have 4 dogs, but I'm knocking on wood that I never experienced that. I feel for the people that do, because it does not look pleasant. I follow one girl on Instagram who had to get her stoma switched to the other side because hers was so horrible. And I'm not saying that to scare you, but I'm saying it to just let you know that there are different things that can happen with your peristomal skin and your stoma. There's a whole bunch of stoma complications that can happen that you should be aware can happen. So that way, if you start to notice something unusual, you know that you can go get help. Anyways, guys, thank you so much for watching this video. Let me know about your skin complications that you've dealt with and what helped with yours. I will provide the resource for the UOAA and their stoma clinic, their virtual stoma clinic, in the description below, as well as, you know, a guide for different types of skin irritation. But thank you so much for watching. And oh, I wanted to say that if you watched my recent video where I cut my fingernail off, thankfully I have very fast growing nails, and it has already pretty much healed. It looks weird, but it's pretty much healed. So that was it. Thanks for watching. I'll see you guys in the next. Bye, guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel, like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.